Hey, it's Parson. Subscribe, hit the bell, because why? Stay tuned, because at the end of this video, we'll share information of how you can help. We're coming to you from Los Angeles, California, and today we are incredibly grateful to be able to have a conversation with Dr. Kyle Annen in Denver. She is doing some remarkable work in regards to blood and convalescent plasma. And without wasting any time, let's get straight to it. Doctor, thank you so much for taking a moment to talk with us. Tell us a little bit more about yourself and the work that you've been doing, please.
I'm Dr. Kyle Annen. I'm the medical director of the transfusion service at Children's Hospital, Colorado.
This has got to be a strenuous situation. How are you? How are your colleagues, and how are your patients during this time?
Well, fortunately, COVID-19 has not had a significant impact on the pediatric population. So we've been very lucky in that we don't have the ICU full of sick kids with COVID-19 right now. Obviously, there's still the other disease processes that happen every day. We are very fortunate in that I haven't had to actually give convalescent plasma to one of our own patients. Created an opportunity for me to try to help the community in Denver by providing convalescent plasma to other hospitals in the area.
And on that note, that's really why we wanted to get you on and have a conversation with you. Convalescent plasma, please tell us more about that. Tell us more about the work that you've been doing and how it might possibly help fight against the coronavirus.
So convalescent plasma is plasma that's taken from someone who has recently recovered from having COVID-19. So normally, every one of us walking around has what's called memory B cells. Those are one of the cells that we have in our body that fights infection, and they do that by creating antibodies. And we all have a memory B cell for every kind of sickness we've ever had. And lots of allergens and exposures too. And so someone who has just recovered from COVID-19 now has billions and billions of antibodies in their blood. Fortunately, that means that they are not going to get, or probably not going to get, COVID-19 again. We don't know for sure that people are not able to be reinfected, but in the immediate time frame, they shouldn't get it again. And so people who currently are sick with COVID-19, especially people who are very, very sick, usually also have some kind of immunosuppression going on, reduced ability to fight the infection, a reduced ability to create their own antibodies. They're so sick that their bodies are deteriorating, essentially. And so what convalescent plasma does is we take the plasma from these people who have recovered and are now full of antibodies and take a little bit of their antibody out through plasma and then infuse it into people who are currently ill. And that just gives them a big dose of antibody, which hopefully goes in, helps clear out some of that virus, and maybe gives them a chance to start getting back under control.
That is absolutely incredible. So how long have you and your team been working on this?
Since Tuesday.
All right.
Yeah, so the FDA approved the ability to give convalescent plasma or use convalescent plasma just a week ago. So it was really only approved by the FDA for a couple of days before we were able to collect and issue the first transfusion. There was a little bit of discussion about convalescent plasma kind of in my medical field for a couple of weeks before the FDA came out and said that it was available. And that was based on some research that was done in Wuhan, China, suggesting that convalescent plasma worked because it was tried in China. We don't definitively have proof that this works from a research standpoint. I have heard that a randomized controlled trial was performed in Wuhan, China, and that it is very strongly supportive of convalescent plasma, but none of us, at least as I certainly haven't actually seen that study, so I can't say for sure that that's true.
Well, that's the work you're doing now. I mean, it's in the testing phase.
Right. So the treatment I'm doing is considered experimental, and the treatment I'm doing. So what we do is every patient that needs it the FDA individually approves that patient to get the transfusion. And then we are issuing the transfusion. Now, we hope to participate in a research study to determine whether or not this is beneficial. But right now, my priority is making sure that patients who need this can get this.
So if you were suggesting this treatment, is there anything that the general public could do to help move it along?
If you've had COVID-19 or you think you've had COVID-19, so right now the requirements are if you've had COVID-19 and you had a positive test performed by PCR, that means that actually measures the virus in your body, and you've been completely asymptomatic for 14 days, then you're eligible to donate convalescent plasma. Now, you also have to qualify for all the other regular blood donation requirements, but those are essentially the 3 requirements right now. If you are eligible, we would repeat the nasopharyngeal swab and repeat the test. A nasopharyngeal swab is a swab that goes in your nose and it feels like it's poking your brain.
And so that's how you generally take the COVID-19 test.
That's the COVID-19 test. Yes.
Okay.
It's a swab that goes in your nose, and we touch the back of your nasopharynx, so the very, very back of your throat, to make sure that we're getting where the virus is supposedly replicating. And then we can use that. We take that swab and we actually test the DNA or the RNA in the virus. And that tells us whether or not it's there. So we would then repeat that test after you've been asymptomatic for 14 days, and it should now be negative. And then when it's negative, you are eligible to give convalescent plasma.
So explain, if you can, what would be the difference between pre-coronavirus and post-coronavirus RNA?
So the test itself is for the genetic material of the virus itself. So what we are testing is to actually prove that the genetic material of the virus is present.
So all of this is absolutely over my head, but I do think that there's a lot of people in the general public that have questions. One thing being, we've noticed that young people are very resilient to the virus, and I'm wondering, do you think that there's anything that we could learn from our youth in fighting the corona epidemic?
I mean, when it comes to kids, we're very, very careful about anything that we do. And in general, things need to be really solidly proven in the adult world before we will then try to translate it into using it for kids, because we need to just be that much more careful. I mean, think about the fact that from a medical standpoint, anything that you do with a child means that that child has to live with that outcome for much, much longer than any adult, because they're younger. If you do something, if you have a medical treatment for a 40-year-old, then, and maybe that 40-year-old has another 40 years, and you're trying to decide how you're going to treat that person, or you're potentially doing something that is experimental to that person, you're potentially impacting 40 years, but you're potentially impacting 80 years if you're doing something to a 2-year-old. So we always think about like what the impact is. Like if you were to do something that, like a blood transfusion, right? My field, if a child got a blood transfusion and they got hepatitis from that, I mean, that's more years of potentially.
Yeah, absolutely. No, that, and thank you. That is a very valid, not only medical but ethical thought. Thank you. And that, it makes me curious. How do you, as a medical professional, feel that the media has handled their coverage during this crisis?
Because I'm in a children's hospital, and I'm not seeing a lot of cases personally. Also, as a clinical pathologist, I'm one of the behind the scenes doctors, so I'm not out on the floors. I'm not the one actively taking care of these patients. I'm providing a therapy that then the physicians actively taking care of these patients are then using. I mean, I do think that the concern is warranted for the fact that we're continuing to spread the disease, and the concern is warranted for the possibility of overwhelming our medical system. I think that most of the things that have been put in place have hopefully really made a difference and really hopefully slowed the disease progression or the disease contagion. It's really difficult to sort out in the media what is true and what is not true. And, I've gotten emails from people asking me, is this true or is this not? For example, there was that email that was being sent around, and it was even on the news, about that test for COVID-19. Easy do-it-yourself test, supposedly. You had to hold your breath for 10 seconds. And if you couldn't hold your breath for 10 seconds...
We heard about that.
It said you had COVID, and they said that the claim was that this came from the board of medical directors from Stanford. Well, first of all, medical board of directors do not issue recommendations like that. So that was my first tip off that was wrong, because I know that that's not the kind of stuff that comes from a medical director's board on a hospital.
Out there.
That was just ridiculous, right? Like, I knew that holding your breath for 10 seconds does not prove that you do or do not have a disease.
It sounds ridiculous, but the most concerning thing is that how many people took it seriously.
It was ridiculous. And I mean, I know that a lot of people don't have, obviously, the medical background that I do. But it's one of the things that I think can cause a real disadvantage and can be dangerous, right? This is one of those false news things that can be dangerous, because what if someone's like, oh, well, I can hold my breath for 10 seconds. I don't have it. And then runs around and coughs on people.
Of course. Yeah, and that brings me to one of my core questions, which is, how does this disinformation impact you and your colleagues doing your jobs on the front lines every day?
From my standpoint, I think the biggest challenge has just been, as the information about convalescent plasma has come out, I have a lot of people who want to know if they can donate anyway, even though they didn't have an initial COVID positive test. Now, that's not false news. That's not bad information. But it's right now it's a little difficult to sort through all of the calls that are like, I want to donate, but...
So just to be clear, if you don't have or have not had the coronavirus, you are not eligible for this particular therapy.
If you have not had a confirmed positive COVID-19 test...
Right, okay.
Then you are not currently eligible, at least at my facility. Now, the FDA did literally just change the rules, and things are changing a lot, but they did just change the rules, I think it was Friday, to say that if you had an antibody test, you could be eligible. But we don't have an antibody test yet. I don't have an antibody test at my hospital. And I don't know of a lot of places that do. There are some places that have that up. But until I have that available, I still have to follow the other rule.
And that's why your work and your research is so important. And thank you for that.
Absolutely. If I can add one more thing.
Please.
For those people, if you were asking before about, how can everyone help, you can donate blood, right?
Oh, maybe of course. Yes.
Maybe you're not eligible for convalescent plasma. If you think you had it and you can't get tested, you're eligible to donate after being symptom-free for 28 days. And if you are healthy, please go donate blood. States like California and Washington have critically low need. I've been fortunate that my hospital has had an amazing response. We were getting dangerously low, and fortunately, we've had an amazing response. We've been able to manage.
Are there any resources that you could share for folks that are really interested and want to donate blood, but are hesitant because of the current health situation?
The American Red Cross has sites all across the country.
Okay.
Vitalent is another blood donation organization that has sites all over the country. If you're in the Midwest, you could reach out to Versity, which sounds a lot like Vitalant, but they're different, I promise. There is, if you're in New York City, New York Blood Center. And I think those are all the really big ones.
Thank you so much. And we will share that information plus more below in our description. Dr. Annen, where do you see your research going? What is the next step? And how can people help you in your efforts?
Well, I really hope that, first of all, that everyone that I'm providing this convalescent plasma to, that it really helps them get better. That's the most important thing. And the feedback I've gotten from people who have received it, it makes me so happy to know that anyone is even a little bit better. And as far as research goes, I am hoping to be able to contribute samples from the donors to a bigger collaboration to be included in trying to figure out, kind of prove definitively that this works. And I think one of the things that's important about proving that convalescent plasma works is I think we can jump on it faster the next bad disease that comes through. This has always been an experimental treatment. And I think if we can prove it works in COVID-19 more definitively than we've proven whether or not it worked in H1N1, Ebola.
Right. From your perspective, how do you see this playing out ultimately?
I think there's going to be a lot of requests for convalescent plasma as people understand more that it is out there and that it seems to work. I think that if that study that I mentioned before comes out and it does in fact strongly suggest that this works, that will only increase the demand, and rightly so, which will be good, right? Because having any treatment for this will be wonderful.
Yeah, of course.
And then I think that the research, all of the data that we're getting on all of these patients that are receiving the treatment will hopefully get us past this and then provide us with information to better prepare us for the next bad virus, because there's going to be more. I mean,
so you're saying that this is likely not going to be a one-time situation?
I don't think that anyone in the epidemiological world, and I'm not an epidemiologist, but it's a fact. We had H1N1. We had the first SARS, which fortunately didn't get around too much. That was also a coronavirus. We've had other bad flus, just even a really bad flu. Anything that's a virus, we don't necessarily have something in our arsenal that we can immediately use to treat. And so convalescent plasma might be a much quicker, more official go-to treatment in the future if we can prove definitively that it was successful in COVID-19.
Thank you so much, Dr. Kyle Annen, for spending some time and sharing some real information and insight with us. We appreciate it so much. And it's people like you and other frontline people that we really need to tip our hats to. Thank you. If you like what you saw and you enjoyed the conversations we're having, then subscribe and hit the bell, like us, and that way you'll get notified the next time we are having a great conversation with a spectacular human being. And also, if you know anybody who has a story that needs to be told, hit us up. Make sure that you follow us so you can get all the information right down here. Thanks for watching.